forgot to change the title. There you go, perfect. Screen capture? Probably resets every time, does it? Game? This game's so loud. There we go. 3D body adventure. So we have a story mode. We have information mode. We got memory game. We got 3D movie game.
Save the
Let's do a
patient.
campaign
It's
first.
up to you.
This game's still fucking loud. Holy shit.
Doctor, we just received 4 new admissions, and they are all in serious condition. To interview a patient, get more information, or start a procedure, just click on the appropriate console. Click to start.
Fucking dimensions change. Enter. That's all I have to do. Whoa! Zzz. Why play Doom when you can't play this game? Look at the speed. Holy shit. Yo, damn. This brings back my preschool years. This is why I talked about that one stream. Is walking outside the hospital. Super FPS. And I never got a chance to play this with sound. It's fully voiced too, isn't that fucked up?
The front entrance to the hospital is locked after hours. If you want to enter at this time of the night, you will need to go around back to the rear entrance.
Yeah, Scott. And I figured, like, well, while we're playing a hospital game, might as well play it too, you know? Get in there! Zoom. Where is over there? The patients are dying, but fuck it. Yuck. What the hell?
Coronary angiography. It is often desirable to study the coronary arteries of patients with coronary artery disease. Many different tests have been devised to do this. At present, the definitive test for evaluating the coronary arteries is angiography. Coronary angiography is an invasive test that requires placing a catheter in the coronary arteries. Dye is then injected, and detailed pictures of the coronary arteries are obtained. This test enables doctors to determine the exact location and severity of the plaques within the coronary arteries. The photograph at left shows a doctor performing a coronary angiogram. Several new forms of treatment for coronary artery disease have emerged in recent years. The most well accepted is coronary angioplasty. Coronary angioplasty involves positioning a small balloon catheter in a coronary artery such that the balloon crosses a plaque. The balloon is then inflated to compress the fatty plaque and make it smaller. When the balloon is deflated, the plaque usually remains compressed. This increases the size of the arterial lumen, central opening, and improves blood flow to the heart.
Why did they let us play this as an 8-year-old kid? What the fuck?
The heart. Although the heart is constantly pumping blood, it does not actually receive any oxygen from the blood which travels through its chambers. Instead, the heart receives all of its oxygen from the arteries which encircle it. These blood vessels are known as the coronary arteries. This illustration shows the heart and the coronary arteries. Under normal circumstances, the coronary arteries have significant reserve capacity, and they can easily meet the oxygen demands of the heart muscle. Problems with supplying the heart muscle with oxygen arise only when the coronary arteries become narrowed due to atherosclerosis.
Atherosclerosis. Hurry, doctor, save the patients. Hold on, I gotta go to doctor school first. What is this?
Coronary artery disease. Atherosclerosis is a disease which results in narrowed arteries and decreased blood flow. The arteries become narrowed because of a buildup of plaques within their inner walls. This illustration shows a yellow plaque within the inner layer of an artery. Plaques consist of a mixture of substances,
Seems giving me placebo effect.
cholesterol,
I feel like
fat,
I have this right
fibrous tissue, clumps of platelets, and sometimes calcium. Atherosclerosis begins early in life, but generally causes no symptoms until middle or old age. Only after an artery becomes very narrowed will blood flow be diminished enough to cause symptoms. When atherosclerosis affects the coronary arteries, it is called coronary artery disease. Patients with coronary artery disease experience chest pain when the blood supply to the heart is inadequate
the operation
to meet
room?
the demand for oxygen. The respiratory lining. The photograph at left shows a portion of the lining of the upper respiratory tree. Influenza virus.
Oh shit! We just
There
got
are three
taken
main
care of
types
that.
of influenza viruses, named type A, B, and C. The schematic illustration at left shows a single influenza virus. Among the most notable features are the little spikes, shown in white, that stick out from the viral surface. The exact nature of the spikes, glycoproteins, determines the type of the influenza virus. Immunity to influenza occurs when the immune system makes antibodies that bind to these glycoprotein surface spikes. Unfortunately, the type A and to a lesser extent type B influenza viruses are unstable, with new
Crazy how much
versions
voice
appearing every
acting
year.
there is in Baldur's Gate 3.
When a new version appears,
3D body
the
adventure.
antibodies still
Hold
circulating
my
in the body
beer.
from the last bout of influenza will be less effective at eliminating the virus, and the person may get ill once again. Occasionally, an influenza virus will appear that is so radically new that virtually no one is immune to it. When this occurs, the result is a worldwide flu outbreak called a pandemic.
Oh. I hope that doesn't happen.
Influenza virus. The photograph at left shows a single influenza virus. Influenza viruses are responsible for the respiratory illness popularly named the flu. This illness is spread from person to person through the air by virus-infected water droplets that are sneezed or coughed up. Influenza generally occurs in local outbreaks. Outbreaks tend to occur in the winter months, spreading rapidly through places where many people congregate, such as schools, offices, and nursing homes. The typical case of influenza is characterized by fever, muscle aches, headache, loss of appetite, cough, and a runny nose. The illness typically resolves within a week and does not require any treatment beyond rest and fluids. Rarely, influenza will progress and infect the lungs themselves, causing a severe pneumonia that can be fatal even in young, healthy adults. Most deaths from influenza, however, occur in old people who develop bacterial pneumonia because the viral infection lowers their resistance to other infections.
The blood explosion release. I don't know, but this game has a video of a heart attack. I'm doing Google searches. Isn't that cool? Is this where I'm going? I previewed it a bit. It seemed like it was 3D, but who knows? Where's the operation room? The patients are dying. Hold on, man. We've just begun playing the game. Did I leave from the front door? Is that what happened? Is that the moon up there? Beautiful. An actual realistic moon for once. Not the size of a fucking a building. Now I know the moon is actually bigger than the building, but like speaking like, you know, in the sky. Yeah. Is it? Well, I've never been there, so I don't know. There we go. What's this about? Oh shit. Yuck! Colon inspection.
Endoscopy. The photograph at left shows the inside of a normal duodenum as seen through an endoscope. An endoscope is a flexible tube with both a light and a camera lens at its end.
This is the Death Stranding
trailer.
trailer.
Endoscope to examine the digestive tract when a patient develops vomiting or diarrhea that doesn't resolve as expected. Tiny surgical tools can also be manipulated through the endoscope, allowing
Stop
treatment
drinking
of a
apple
wide
juice, it's
variety
easy.
of digestive system disorders.
As a kid, looking at these pictures was sick. Even though I didn't understand anything, they were all like, cool. Wow. It looks like there's like a type of candy that's like, it's kind of like hard candy. It looks like that.
Microvilli. The photograph at left shows a close-up of a mucosal cell which lines the inside of the small intestine. Each of the tiny finger-like projections on this cell's surface are called microvilli. If we were further away, we could see that the inner lining of the small intestine is itself organized into many small finger-like projections called villi. The villi and microvilli together create a surface area within the small intestine that is as large as a tennis court. The main purpose of this lining is to promote the effective absorption of food. This is a job it is quite well designed to perform.
Cool. Glad my body can do stuff by itself. What is this? A fucking legendary
The small
scope?
intestine.
Oh.
The illustration at left depicts a segment of the small intestine. The small intestine is a long tube, about 21 feet or 6.5 meters, whose purpose is to absorb food.
Yum.
The inner layer of the small intestine, the mucosa, is very well suited for this job. It is organized into innumerable little finger-like projections called villi. The mucosal cells which line the villi are in turn covered with even smaller finger-like projections called microvilli. The villi and microvilli greatly increase the surface area with which to absorb food. It is the mucosal cells which line the villi that are most damaged by a rotavirus infection. This disrupts the absorption of food and causes vomiting and diarrhea. The middle walls of the small intestine contain circular and longitudinal smooth muscle layers. Under normal circumstances, these muscle layers contract in rhythmic fashion to force the partially digested food along the whole length of the small intestine. This contraction process is called peristalsis. The outermost layer of the small intestine is called the serosa.
The serosa. What is this?
Rotavirus.
Ah!
The illustration at left shows a single rotavirus. Worldwide, it is one of the most common viruses that can infect the digestive system and cause gastroenteritis. The rotavirus is easily spread from person to person in a family or other group setting. Rotaviruses are also found in a number of animal species. Rotavirus infection is particularly problematic in infants and young children, and it is responsible for many deaths in undeveloped countries, where medical care is inadequate. The rotavirus causes illness by invading the lining of the duodenum and the upper small intestine. The intestinal villi are transiently damaged, but they rapidly regenerate their lining. Illness typically begins with 1 or 2 episodes of vomiting, followed by diarrhea. Uncomplicated cases resolve in about 1 week. Treatment requires only rest and adequate fluid intake to prevent dehydration.
It's crazy how powerful water is. Maybe we should go save the patients. But what's over here? The brain! Only I have the brains to rule like
Rabies
that.
virus.
Ah!
This is a picture of a rabies virus. The rabies virus is a member of a family of rhabdoviruses. Infection with the rabies virus causes a serious illness that primarily affects animals, though people can also contract the illness if they are bitten by a rabid animal. Common animal carriers include foxes, skunks, rabies virus. This is a picture of a rabies virus. The rabies virus is a member of the family of rhabdoviruses. Infection with the rabies virus causes a serious illness that primarily affects animals, though people can also contract the illness if they are bitten by a rabid animal. Common animal carriers include foxes, skunks, raccoons, bats, and dogs. The disease usually begins 2 to 8 weeks after exposure to the virus. Early symptoms include loss of appetite, intense thirst, nausea, vomiting, and fever. The virus causes its ill effects by damaging the central nervous system. It is generally only a few weeks from the onset of symptoms until the patient lapses into a coma and dies.
Damn, okay.
Untreated rabies is nearly universally fatal. Fortunately, treatment can prevent rabies from developing if it is initiated soon after the patient is bitten by the rabid animal.
What a piece of shit. Yo! Look at that! Like, isn't that funky looking? I wonder what it is.
Antibodies.
Oh, cool.
This picture shows several Y-shaped antibody molecules within a blood vessel. Antibodies are made by the immune system to react with specific foreign invaders, such as rabies viruses. Treatment for people exposed to rabies involves administering preformed anti-rabies antibodies obtained from horses. These antibodies bind to the rabies viruses and help the body to eliminate them before they can do any harm. Next, the patient is immunized with killed rabies viruses. These viruses stimulate the patient's immune system to make its own anti-rabies antibodies. Treatment is essentially 100% successful at preventing the disease when it is given within a few days of exposure to rabies.
Few days?
Of historical interest, it was Louis Pasteur who first explained the cause of rabies. He also developed a method of immunization to prevent the disease from occurring. In the 1800s, this was a monumental achievement.
Inject horse into the patients. Sir, are you sure? Yes, inject horse now.
Neuron. The basic function of the nervous system is to transmit messages from one place to another. The nerve cells which do this job are called neurons. Each neuron has a single long branch called an axon, which permits messages to be carried to distant parts of the body. This illustration shows a single neuron with its axon, in yellow, extending off to the left. Normally, neurons perform their functions by conducting electrical signals down the length of their axons. Unfortunately, these same axons serve as the pathway by which rabies viruses migrate from the site of an animal bite to the central nervous system.
My axons are definitely not working.
The further away the animal bite is from the central nervous system, the longer it takes for the disease to develop. The brain.
The
brain. This photograph shows a human brain. It is dominated by the massive cerebrum with its many deep folds. Also seen in the photograph are the cerebellum, located at the back of the brain, and the brain stem. The brain and the spinal cord together form the central nervous system, CNS. The CNS is the control center for the body. The lethal effects of rabies viruses result from infection of the CNS. Without proper function of the CNS, vital functions such as breathing and swallowing stop working. Shutdown of the CNS eventually leads to coma and death. The most reliable method for determining whether an animal is infected with the rabies virus is to examine an actual brain specimen for the presence of rabies viruses.
Let's plop that shit open and just check it. Let's glue it back up afterwards. Where's the operation table? Is this it? Oh shit. What? Mike Connor, he's dying. What does he have? Temperature 37 degrees Celsius or pulse 84 beats per minute. Normal except for an animal bite near the right ankle. Oh shit. Painful right ankle anxiety. You have rabies. You must die.
Unable to commence procedure. Please interview the patient first.
Hello, Mike Connor.
Doctor? I was bitten by a crazy dog yesterday and I'm really scared. The bite hurts a lot. I wasn't even doing anything to the dog. My mom's worried I might get rabies. She said you were gonna stick me in the stomach with a bunch of really big needles. Can I leave now?
No, we have to stick your body with a bunch of big needles. Kill him! You have been transported to the patient's brain.
You have been transported into the patient's brain. Find and zap all the viruses to cure him.
He's dying.
Remember, your patient was bitten by...
Fuck it. Go for it. This is like that Jesus Christ dude. I am Jesus Christ. I gotta watch out to not zap his axons. No, this is FPS gaming. Gotta watch out. What?
Great job!
It's that
You cured
easy?
the patient of rabies.
We gotta become a doctor.
Rabies is a viral infection of the nervous system. The virus is transmitted to humans by rabid animal bites. Many cases are the result of dog bites. Raccoons and bats are other common carriers. Worldwide, there are an estimated 15,000 cases of rabies each year. There are very few cases in the U.S.,
patient is
however,
very ill.
largely as a result of intensive
Hold
efforts
on,
to
I'm learning
vaccinate
here.
dogs. Untreated cases are usually fatal. Treatment is given to patients when there is reasonable suspicion of rabies exposure following an animal bite. The primary treatment involves a several-week course of anti-rabies antibody shots. The treatment works by enabling the body to eliminate all the rabies viruses before the disease develops. Fortunately, the medicine has changed, and it is no longer administered through the stomach.
Yeah, it's just warping their brains. I wanted to say something, I forgot. Next patient, please. Mary Redmond. What is it, Mary?
Ow! Oh, that hurts. Don't poke me in the belly like that.
Hello? Sorry.
Oh, my stomach's been hurting since yesterday morning. I vomited twice yesterday, and now I have diarrhea. Today I even collapsed at work because I felt so lightheaded. Doc, please help me. I'm feeling really sick.
Yeah, you have the Dagon virus. No. It's the Ray virus that makes you puke. Sorry. I'm gonna have to turn you into goo. 110 beats per minute. It might just be horny. Left upper quadrant and epiclastic abdominal pain. Also, if appetite, fatigue, lightheadedness. What did we... I forgot. We just studied for this. How you forgot? Oh well, time to zap.
You have been transported to the patient's lungs. You will need to go exploring to find all the viruses. Your mission is to eliminate the viruses in order to cure her. Remember, she has been suffering from nausea, vomiting, and diarrhea for 2 days.
Oh god.
Avoid zapping healthy cells. Hurry!
And I gotta go to the stomach. Ah! Ooh! Ah! Over here? Oh! Oh, dude, it's the little candy. I'm just crunching them. Yeah. Lemon. Lime, I mean. Yeah. I'm gonna get you healed yet.
Marvelous work! You cured the patient of gastroenteritis. Gastroenteritis is a common cause of abdominal pain and vomiting. It is caused by any of a large number of different viruses or bacteria that a person may be exposed to by consuming contaminated food or water. This case of gastroenteritis was caused by a rotavirus infection. Symptoms can vary from mild to very severe. Generally, gastroenteritis lasts only a few days and resolves without any problems. Treatment depends mostly on replacing lost fluids. It's time to see another patient.
Yeah, I wish it was that simple. Who is it? Male, John Davis.
Doc, I've been feeling terrible for 3 days now. I can hardly move. Never been this sick before. I have a high fever. I'm having a hard time breathing. Keep coughing and coughing. Hardly anything ever comes up. Tylenol helps make my fever go down, but I still feel like I'm going to drop dead. Please help me. I just don't know what to do.
Tylenol is the registered trademark of the McNeil Consumer Product Company. Decrease breathe the sounds bilaterally. Fever, chills, sore throat, chest x-ray, patchy constipation throughout both lungs. Oh shit, gotta dual wield the lungs. Let's go!
You have been transported to the patient's heart.
Oh shit, I got 30, 40?
You will need to go exploring to find all the viruses. Your mission is to eliminate them all in order to cure the patient. Remember, he has been suffering from fever, cough, and shortness of breath for several days. Avoid zapping healthy cells. Hurry! Every second is critical.
Here. Oh, no, that's the brain. Sorry. Destroys his brain cells. Sorry, dude. Die! Am I shooting like the next lung or something? Doesn't seem right. Yo, fucking snapshot, dude. Holy shit. Are we clear? Looks good. Imagine a speed run of this game, dude. Like, now that's a speed run I'd like to see. Pure skill. Omega Doctor time. Hello? Where are you, little creep?
Great job. You cured the patient of pneumonia. Most cases of pneumonia are caused by either bacteria or viruses. In this case, the patient's illness was caused by an influenza virus infection. This is a very unusual cause of pneumonia. Although there is no specific therapy for this viral illness, it is difficult to distinguish influenza virus pneumonia from the more commonly seen bacterial pneumonias. This patient would thus have been treated with antibiotics, as if he had a bacterial pneumonia, such as pneumococcal pneumonia. A failure to respond to antibiotics as expected is often the clue that signals doctors to look for an unusual viral cause, as in this case. It's time to see another patient.
And that's where the doctor goes inside their body, I see. John Atkins? What?
Doc, for the past few months, whenever I walk up the stairs in my house, I feel pressure in my chest. Pain has been getting worse lately. Sometimes I even feel pain in my jaw, my left shoulder. And when it's really bad, I have to sit down for a while. The pain seems to go away. I don't know what to do, Doc. This is making it hard just to get through the day.
Damn. 35 beats per minute. Good temperature. Blood pressure. Blood flow murmur on the left side of the neck over the carotid artery. Chest pain radiating onto jaw, shortness of breath, nausea, sweating. Visible defect in the anterior wall of the heart. Sorry, sir, I'm gonna have to explode your testicles from the inside.
You have been transported into the patient's stomach. Find all of the cholesterol plaques in the patient's arteries and zap them. This will relieve the patient of his disabling chest pain. It will also eliminate the abnormal whooshing sound heard in the patient's neck. Avoid zapping healthy cells as it will cost you valuable time.
Why is this in French? Bruit? Bruit is sound. Yeah! Oh shit, that was a snapshot right there, dude. Oh!
Oh no! You zapped a red blood cell. Red blood cells make up about 30% of the blood volume. When doctors measure this number, it is called the hematocrit. Sometimes the number of red cells in the blood goes down, either because too few cells are being made or because they are being destroyed prematurely. This is called anemia. Under normal circumstances, a red cell stays in circulation for about 120 days before it is removed from the blood by the spleen.
Cool, thank you. Go! It's definitely the hardest level. Here, I think? Don't worry, I got you.
Very well done. You cleared the cholesterol plaques from the patient's arteries. The patient had symptoms of angina pectoris. Angina occurs when the oxygen supply to the heart
like
muscle is
vagina's
inadequate
sister?
to meet the heart's demands. The heart is deprived of oxygen, and the patient experiences pain. Most commonly, angina occurs with mild stress or exercise. Angina is caused by narrowing of the coronary arteries, usually due to a buildup of cholesterol plaques. The pain can be relieved with medication, but definitive treatment requires intervention to restore normal blood flow to the heart muscle. Coronary balloon angioplasty and coronary artery bypass grafting are the most common methods of definitive treatment. Congratulations! Now see if you can cure all the patients faster.
What? Mike Connor, why you got bitten by a dog again?
Doctor, I was bitten by a...
Die! Fuck you, Mike. Do not have the insurance for this.
Oh no! The patient is now in critical condition. This procedure has been terminated. Stand by for unit reset.
Oh yeah? Reset this, bitch. Fuck you, Mike.
Oh no! The patient is now in critical condition.
You'll never catch me.
Has been terminated. Stand by for unit reset. Please attempt the procedure again immediately.
No, you can't trust me. How'd I leave? Quit. Yes. Play body recall.
Body recall.
Click on one of the 12 tiles to see.
That's not it. Oh, that's not it. That's not it. Heart.
Kidneys.
This is hard. Liver.
Liver.
Bloop. Oh, you get to see a little animation. That's not it. Heart. Ooh.
Brain.
Brain. Lungs.
Lungs. Stomach.
Penis. Yo, look at that stomach go. Damn. Look at the moves.
Great job.
Oh god.
Shoulder.
Oh. Spine. Thing. Elbow. Penis.
Ankle.
Cool.
Pelvis. Vertebrae.
Oh, the vertebrae.
Knee.
Nice. Look at that
Well
knee.
done.
Well done. Holds vocal cords. Makes insulin. Oh, this is
Larynx.
the larynx. Oh, it's just a slight description. That's the insulin.
Pancreas.
Making insulin. It's like a chicken breast. Babies grow here. The uterus. Where? Testicles.
Uterus.
Uterus. Absorbs food. The testicle.
Gallbladder.
No, that's really testicle.
Intestines. Ear.
Yo, why you look so creepy?
Great job, Doctor.
What? What is this? Huh? This is a Dr. Dick video. I gave him his uterus back.
3D Body Theater. To select a movie, click on one of the 5 movie icons displayed across the bottom of the screen. To play the chosen movie, click on one of the 4 play buttons displayed on the right side of the screen. Use the scroll buttons to display additional movie icons.
Don't worry, we're basically getting bored in all of them. The brain! We can watch it in 3D. Full screen? Oh fuck.
Brainstem.
Brainstem.
Pituitary.
Yeah, I'll put it in 3D next time.
Cerebellum. Occipital lobe.
Holy shit.
Parietal lobe.
Constructing the
Temporal lobe.
brain.
Frontal lobe.
Stop! Andros should come back alive! Stop! Only I have the brains to rule like that. Oh, thank God they only finished half of it. Now this is brain music. No! Don't finish him! It's over for you, Star Fox. Whoa! Quick, bomb his hole! Is it reset?
Brainstem.
No. Flyby through the ear. Yo, it's in 3D! Holy shit! Fish Shark, is it real? Yo! Damn! This is just like Star Wars. Yeah.
Eardrum. Ossicles. Semicircular canals.
Music's way too loud, bro. Yeah.
Cochlea.
It's the little snail that's telling you things inside your ear. Whoa!
Cranial nerve 8.
8? Damn. Looks like a gun.
Pinna.
Read this. This is where we find your mom's pussy. There. Why do they have to go so hard on the beats?
Right atrium.
You can't even hear him.
Tricuspid valve. Right ventricle.
Left
Pulmonary
testicle.
valve. Pulmonary artery.
Yep. This is what it is. This is a shmup book. Whoa!
Left atrium. Mitral valve. Left ventricle.
The guy on the keyboard just can't help himself. He's got a jam.
Aorta.
Whoa! No crypt out of there. Flyby of the skeleton. 3D skeleton. You ready for this? Ah!
Tibia. Femur.
Dude, First Shark must be freaking out right now.
Sternum.
Having those
Cervical spine.
red and blue glasses is always something I tell myself I'm gonna get at some point. I never do. And now I'm missing out for it. Look at giant. There's a giant fucking
Jurassic
skeletons in my room.
Lumbar spine.
When you visit Spirit Halloween for 1 second.
Scapula.
Holy shit, that angle. First Shark is dead.
Tibia.
Tibia. Yes, the center of the spine. La moelle épinière.
Cervical spine. Thoracic spine.
But I'm making it look
Lumbar
like a
spine.
pussy, dude. This pussy. Be crawling in your spinal column. There's definitely crawling in spinal column music. They knew what they were doing. I think the next video is the heart attack. No, where is it? It's like a heart. Yeah, there's. Click to select the heart attack movie. Hey, let's not get ahead of ourselves now. Wow! Damn!
Esophagus.
Esophagus.
Stomach.
Oh yeah.
Fundus. Pylorus.
Me when I'm in the pylorus.
Duodenum. Jejunum. Ilium.
Jeez. I can't imagine this in 3D.
Ascending colon. Transverse colon. Descending colon.
What the fuck?
Sigmoid colon.
Fucking acid trip. Grump. See, 4.
Esophagus. Stomach.
Through a muscle fiber.
Muscle cell. Myofibril.
Whoa, holy shit.
Actin.
Yo.
Myosin.
Damn, they got really creative with the flybys.
Muscle cell. Myofibril. Actin.
Oh, so seamless, I don't even notice. Oh, this one's just this tiny screen. Yo, what the fuck?
Right atrium. Tricuspid valve. Right ventricle.
It's so gross.
Atrioventricular valves. Pulmonary valve. Pulmonary artery. Left atrium. Left ventricle. Aortic valve. Aorta.
There, Luke.
Right atrium.
The Heart Cycle movie. Click to select the Heart Conduction System movie.
SA node. AV node. Bundle of His.
Huh? Just saying random shit.
SA node.
But no.
AV node. Bundle of His.
Alright. Heart Attack movie. In 3D. Oh god. Yo, put a Q-tip in there. No! Oh! It's the Mission Impossible scream. He's fucking dead. Damn.
Myocardial infarction.
Too much cum. Oh shit. Those are stock sounds? I thought Tom Cruise made those noises. The Artery movie. Oh, this is my favorite movie. What the fuck? Is this real? I can't even tell because of the 3D effect. This is probably the scariest game we played this month. This thing, true. It's coming at you. Mostly in 3D, you'd be trying to dodge them. Like, ah, please stop! What's it like in not 3D? Wait. This is not... Yo, what the fuck? It's like mozzarella cheese going through there. Like, I just don't know if this is real, man. There's no way they have the camera for that. But seeing the other 3D graphics, like, this music's not helping either. The periscope. The capillary movie. it is definitely real. I think that might just be it. Right, it doesn't even look different. The Popularity Response movie. Yeah, well, I'm guessing if it's not like
Pupil.
an actual 3D thing, then. Shit, is I guy in chat? Cool.
Pupil.
It looks so much cleaner now.
Pupil.
Pupil. Pupil. Yeah, no, right?
Pupil.
Just scooped out like ice cream. Okay. Not many left. The Lens movie. T.
Retina.
Yo, yuck. Look at the inside. T. Did you know that life is actually upside down? There are music. Retina.
Retina.
It's crazy how the eye do that, huh? Watch out, been not 3D. Wow! The eye structure movie.
Sclera. Retina. Lens. Iris. Cornea.
Yeah, like mine for sure. So crazy.
Sclera. Retina. Lens.
The Brain Synapse movie. Oh fuck. Brain Blast! Whoa! What the fuck? This is so scary. It's like the Empire of the Void. It's like a 90s anime movie right here. In the last 20 minutes of the film. Whoa. Why they put that goofy ass sound in there? Is that a cheat code? View inside the pussy. Yeah. You freak the crowds out. Alright, well, that's most of the game. Now we can just
Prepare for body imaging and exploration.
learn about any body part that we want. Yo, what the fuck? This guy's got a pussy? Click directly on the body to begin exploring. To move the body to a new position, click on the rotate button. Investigation section.
Click directly on the body to begin exploring.
Penis.
Male reproductive system. The illustration above shows part of the male reproductive system. Sperm production begins in
Cannot
the
show a real
innumerable
penis.
seminiferous tubules within the two testes. A close-up of a seminiferous tubule is shown along with the developing sperm cell. Sperm then move into the epididymis where they mature. Shortly before ejaculation, the mature sperm are propelled from the epididymis into a long tube called the vas deferens. The vas deferens carries the sperm to the seminal vesicles, which add seminal fluid to the sperm cells.
They put dye in the cum.
The semen then travels along two short ducts to the urethra. Lastly, the urethra passes through
Injected
the
food
prostate, which
coloring
adds
in
more
the
secretions
guy's
to the
testes.
semen before it leaves the body.
The prostate. Prostate cancer.
Prostate cancer. The prostate gland surrounds the urethra, sitting just below the bladder in men. Its normal function is to add secretions to semen. As men age, however, it is common for the prostate gland to enlarge. This enlargement may partly cut off the urethra, making it difficult to urinate. Usually, this enlargement is entirely benign, and it is treated only if the symptoms require that something be done. However, one must always be concerned that the changes in the prostate are due to cancer. Prostate cancer is one of the most common causes of cancer in men. Like breast cancer in women, it is a disease that has a good prognosis when it is discovered early and treated. In recent years, there has been a significant increase in the use of prostate cancer screening tests. It is hoped that this trend will save many lives in the future.
True. Prostate exam, guys, important. You know, I was thinking about it the other day. In Baldur's Gate 3, Raphael talks about, like, something sperm. How does he know what a sperm looks like? They don't have the fucking technology. What is he saying that? Cum is just man goo for them. They don't know what a sperm looks like. Unreal. Kind of a fake game, I'll be honest. Breast.
The breast. The primary function of the female breast is to produce nourishing milk for a newly born baby. The female breast is well suited for this job. It consists of 15 to 20
Why not
rows
the male
of
breast?
milk-secreting glands that are embedded in fatty tissue. The milk glands all empty into a network of ducts that exit the breast at the nipple.
And donated to his
production of
local
milk
aquarium.
is called
True for
lactation.
sure.
Lactation is maintained after delivery by the hormone prolactin, which is secreted by the pituitary gland. The breast contains no muscles. Instead, it is held up by fine ligaments that connect to the skin in front and the chest wall behind.
Yeah, but sperm is so small. Lactation. Breast. Am I here? Edward Jenner.
Edward Jenner. The principle of vaccination is one of the landmark discoveries in the history of medicine. This triumph is credited to Edward Jenner. In his time, the great scourge was smallpox, a highly infectious and lethal viral infection. Its impact on the population at that time dwarfs the impact that AIDS, the worst scourge of our time, is having today. Edward Jenner made the astute observation that the milkmaids of that day rarely ever developed smallpox. He reasoned that something about their tendency to contract a similar illness called cowpox might be involved. He hypothesized that these milkmaids were resistant to smallpox because they had already contracted a similar illness. In 1796, Edward Jenner tested this hypothesis by inoculating his 8-year-old son with material obtained from a cowpox lesion. 6 weeks later, his son proved resistant when he was challenged with material from a smallpox lesion. The principle of immunization was thus established. This is an epic story indeed, when you realize that Edward Jenner's young son would likely have died if Edward was wrong about his hypothesis.
Really an epic story.
As an interesting footnote, the elimination of the smallpox virus ranks as one of the most significant successes of the World Health Organization. In 1967, the World Health Organization mounted a campaign to eliminate smallpox from the earth, which culminated in 1977, when the last known case was recorded in Somalia. Only research strains of the smallpox virus remain, located in a few laboratories in the world.
Uh-oh. The text is being printed. Enlarge image. Wait, I can enlarge breast? Wow. This is a movie? Oh, you mean for... nipple. Keeping the beat?
Keeping the beat. The heartbeat is usually divided into two main phases called diastole and systole. During the first phase, diastole, the heart relaxes and fills with blood. During the second phase, systole, the heart contracts and pumps out the blood.
Yeah, hold
the
on,
heart
man.
typically spends about 2/3 of its time in diastole
Yeah, makes it 3D.
and 1/3 of its time in systole. Keeping this activity well-timed is the job of the heart's conduction system. The signal to begin a contraction starts in a small region at the top of the right atrium called the sinoatrial SA node. From this point, the contraction spreads over the two atria like a wave.
Sexual or assault.
The atrial contraction pumps the blood down into the ventricles. Next, the signal to contract reaches a small region of the heart called the atrioventricular AV node. As its name implies, the AV node sits right between the atria and the ventricles. The AV node is smart, and it delays the signal just long enough to allow the atria to finish contracting. From here, the signal to contract travels down special fibers that connect to the bottom of the heart. This causes the ventricles to contract from the bottom to the top and ensures that the blood is pumped up and out into the lungs and the body. At the end of the cycle, the ventricles relax and the whole process begins again.
And listen to shit. 3D breast. Okay. Was he a 3D uterus?
Female reproductive system. The female reproductive system.
Shut up.
Ectopic pregnancy.
What the
Really,
hell?
an embryo-
Hold on, man.
Twin.
Fuck. In the
Uterus and ovaries.
check
The
this shit
uterus
out.
is a
3D uterus. Isn't that crazy? Let's learn about the uterus. What the fuck is this? Wasn't there a Talkman? Speak. Whoa! Please.
uterus and ovaries.
This is not read out loud? Why?
The uterus is a strong, muscular organ with which a woman is able to nourish a fertilized ovum until it has grown into a fetus ready to be born. The uterus has a remarkable ability to grow tremendously during pregnancy and then rapidly contract back to its normal size soon after delivery. Before fertilization can occur, however, an egg cell, ovum, must be released and a sperm cell must reach it. A carefully orchestrated hormonal process needs to occur in order for an ovum to mature and be released from one of the ovaries. After this, the ovum must be captured by the feathered edges, fimbriae, of the fallopian tube and guided down toward the uterus. For the sperm to reach the ovum, it must pass through the narrow opening to the uterus. This opening is called the cervix. For most of every month, the cervical opening is blocked with thick mucus that is inhospitable to sperm. At the time of ovulation, however, the cervical mucus becomes thin and conducive to sperm trying to swim up towards the waiting ovum. Whether or not fertilization takes place, the mucus soon becomes thick again, awaiting the next release of an ovum before it changes back.
Anti-Dujin artists need to play this game. Oh. Dujin.
The knee.
The knee.
The knee is the hinge joint that connects the main bones of the leg, the femur and the tibia. The kneecap, patella, lies over the front of the joint. There are strong ligaments on both sides of the joint called the medial and lateral collateral ligaments. There are also two ligaments within the joint called the anterior and posterior cruciate ligaments. All four of these ligaments serve to connect the bones of the knee and to provide additional stability. Like other movable joints, the bony ends of the femur and tibia are separated by protective cartilage which serves as a cushion between the bones. There are two of these cartilage cushions in the knee. They are called the medial and lateral menisci. The powerful quadriceps muscles are responsible for straightening, extending the leg at the knee joint. These muscles are in the front of the thigh. The kneecap is actually a large bone within the quadriceps tendon. The quadriceps tendon is thus commonly referred to as the patellar tendon. The hamstrings are the muscles which bend, flex, the knee at the knee joint. These muscles are located in the back of the thigh. There are a number of common knee injuries. Severe twisting of the knee will frequently sprain one of the knee ligaments. The difference between a sprain and a strain is often confused. A sprain occurs when a ligament, fibrous connection between bones, is damaged. A strain occurs when a muscle or tendon is damaged. Running can sometimes injure the knee by straining the patellar tendon. The cartilage cushions, menisci, within the knee are also frequently damaged by severe twisting. A torn meniscus is very painful and usually requires surgical repair.
Click for more about the compact bone.
Tibia. Compact bone.
Whoa!
Bones are formed of a thin outer surface layer, periosteum, containing blood vessels and nerves, an outer shell made of dense compact bone, and a core composed of spongy bone.
Spongy bone!
The dense outer shell is made of orderly columns of bone cells that are mineralized with calcium phosphate to make them resilient and strong. These bone columns are called Haversian canals. The photograph above shows a number of Haversian canals in cross-section. Bone growth and shape is the result of a delicate balance between calcium deposit and resorption. Osteoblasts are bone cells that work to deposit new calcium phosphate taken from the blood, while osteoclasts work to resorb calcium phosphate and return it to the blood. This balance is controlled by many different hormones: growth hormone, sex hormones, adrenal hormones, thyroid hormone, and parathyroid hormone. It is very important that the amount of calcium in the blood be strictly regulated so that muscles and nerves in the body function properly. The growth and shape of bones is also influenced by the mechanical stresses placed on them. This ensures that the bones that support the weight of the body are very strong.
Magnets.
Pictures from magnets. Magnetic resonance imaging, MRI, is a valuable diagnostic technique that has been in general clinical use since the early 1980s. MRI provides doctors with very high-quality images of the body without using X-rays. MRI works by detecting weak radio signals that are emitted from the hydrogen nuclei, protons, within the body. This works well because each water molecule, H2O, contains 2 hydrogen nuclei, and nearly 99% of the molecules in the body are water molecules. Because water molecules are small, however, the body is only about 60% water by weight. During the MRI exam, the patient lies in a large, powerful magnet. All the hydrogen nuclei, protons, in the body promptly align with this magnetic field. Normally, these protons are all tumbling about randomly. The MRI machine is able to align them only because its magnetic field is more than 10,000 times stronger than the usual magnetic field on the Earth. After getting all the protons into alignment, the MRI machine emits a strong radio frequency pulse, which briefly knocks all the protons back out of alignment. As the protons come into alignment once again, they emit a weak radio signal of their own, which is detected by the machine. The strength of this signal depends both on the concentration of the protons and what else is around them. For practical purposes, the concentration of protons is the same as the concentration of water. For instance, bones have very little water, so they have almost no signal and appear black with MRI. In contrast, fat has lots of water, and it emits a bright signal, which appears white with MRI. The MRI machine is able to distinguish the signals coming from each tiny little piece of tissue, and then recombine them to form an exquisitely detailed image. MRI has found widespread use in many areas of medicine. It is a particularly valuable method for imaging the brain, spinal cord, spine, shoulder, and knee. Its value in imaging other parts of the body continues to grow as radiologists learn more about how to perform MRI exams. There are no known risks or side effects associated with MRI. There is no radiation, and the test can be performed repeatedly without adverse effect. However, MRI should not be done on some people with metal implants within the body, and on people with pacemakers or other electrical devices that are sensitive to high magnetic fields. Also, the tunnel-like hole in the magnet where the patient lies causes great psychological stress for people with claustrophobia.
Fair enough. Learn about back pain. Learn about this guy's bones.
Back pain.
Oh.
Neck and back pain are very common ailments. Most commonly, this pain results from strain of the muscles which support the spine. This type of pain is best treated with rest and heating pads. Occasionally, however, there is damage to the spine itself. Arthritis is the most frequent cause of spine problems. One of the ways arthritis can cause pain is by narrowing the small openings through which the spinal nerves exit from the spine. This causes pain by directly putting pressure on the spinal nerves. Another cause of back pain is damage to one of the intervertebral discs. A ruptured disc occurs when severe pressure forces the jelly-like core of the disc out through the tough disc capsule. A slipped disc occurs when severe forces move the disc out of its normal location. Disc injuries are serious, and they typically require surgical treatment to fix. Sciatica is a general term for back pain that extends down into the buttock and leg along the course of the sciatic nerve. Sciatica usually results from pressure on the lumbar and sacral nerve roots that exit the spine to form the sciatic nerve. Arthritis and disc damage are just two of many causes of sciatica.
Learn about the AIDS virus.
AIDS virus. Every
Scary
time period
music.
appears to have had its own scourges, and our time is no different. Today, the health community and the public are confronted with the AIDS problem. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is a clinical condition in which the body repeatedly succumbs to opportunistic infections because of a weakened immune system. AIDS is caused by the human immunodeficiency virus, HIV. Thus far, it appears that all individuals who contract HIV will eventually develop AIDS, a uniformly fatal disease. There are medications that slow the course of the disease, but no definite cure is on the horizon. One would think that the answer to the problem lies in an effective vaccine, but scientists have thus far been unable to make such a vaccine. HIV is an unusual virus in that it attacks the very cells in the immune system whose normal role would be to kill the virus. No such virus had ever previously been isolated. Fortunately, the routes of HIV transmission are well understood and show no signs of changing. At present, it is only possible to contract HIV by exposure to either blood or genital tract secretions from an infected person. Unprotected sex with infected partners and needle sharing remain the most common routes of transmission by far. Exposure to HIV through blood transfusions was largely eliminated in the mid-1980s, when screening tests for HIV became available. The picture above shows a virus budding out from an HIV-infected lymphocyte. The spleen.
The spleen is an organ whose major functions are to remove worn-out or misshapen red blood cells and to help fight infections. The spleen has a sponge-like internal structure that is filled with lymphocytes and phagocytes. The phagocytes, engulfing cells, do their job by engulfing foreign particles. The lymphocytes perform their role by producing antibodies which help in the elimination of foreign invaders. In the fetus, the spleen actually serves as the site of red blood cell production, but this job is taken over by the bone marrow after birth. Although helpful, the spleen is not an essential organ. If it is either removed surgically or rendered non-functional because of disease, its functions are taken over by other parts of the body. People without spleens, however, do become more susceptible to infections by certain bacteria. The most common cause for spleen failure is sickle cell disease.
Class too, Maple Story.
The abnormal red blood cells damage the structure of the spleen and cause it to stop working, usually before the age of 10 years.
They're called
the intestine.
The intestine is the major part of the digestive system, extending from the duodenum to the anus. It is generally divided into the small intestine and the large intestine. The primary function of the small intestine is to complete the digestion of food and then absorb the useful nutrients into the blood. The small intestine consists of three major sections called the duodenum, the jejunum, and the ileum.
Jejunum?
At the end of the ileum, unabsorbed material containing a large volume of water is passed on to the large intestine. The function of the large intestine is to resorb all the excess water from the undigested food. This process forms feces, which are then eliminated. The appendix is a tiny finger-like process extending from the bottom of the cecum on the right side of the large intestine. The appendix has no known function. Occasionally, the appendix becomes infected, a condition called appendicitis.
The appendix is worthless.
Appendicitis is generally treated by simply removing the appendix. This is the most common abdominal operation.
The colon.
The colon consists of four main segments: the ascending colon,
yeah, they pull out the
transverse
HD mic
colon,
for the colon,
the descending colon, and the sigmoid colon. The appendix is a small finger-like extension from the cecum, which is in turn part of the ascending colon. The primary role of the colon is to resorb the fluid from the watery mixture that is left over after the small intestine has completed absorbing all the useful nutrients.
I saw anus. Where in this?
Crohn's disease.
Yeah!
Crohn's disease is an inflammatory disease that can affect any part of the digestive tract from the mouth to the anus. It is a serious problem that causes many symptoms including pain, fever, diarrhea, and weight loss. The most common site of involvement is the terminal ileum, where the small intestine joins the large intestine. The inflammation generally becomes quite severe, sometimes even causing holes, fistulae, to develop in the walls of the intestine. Crohn's disease tends to be patchy in its involvement of the intestine, with areas of disease interspersed with regions of normal intestine. Treatment for Crohn's disease is directed at relieving the inflammation. This is usually successful at controlling the disease. There is neither any known cause for the disease nor any definite cure. Surgery to remove affected segments of the digestive tract is always a last resort because the disease tends to recur in other segments. A related inflammatory bowel disease is ulcerative colitis, UC. UC is different than Crohn's disease in a few important ways. It only affects the colon, sparing the remainder of the digestive system. It affects continuous segments of the colon, so there is never interspersion of normal and diseased intestine. Only the inner lining becomes inflamed with UC, whereas the full thickness of the intestinal wall is affected with Crohn's disease. Treatment is about the same, however, with medicines directed at reducing the inflammation. Of special note, people with UC are at high risk of developing colon cancer, and they must be screened regularly. Sometimes it is prudent to simply remove the colon to prevent colon cancer from occurring.
Damn. Remove the whole colon? Let's zoom in. Let's get out of there. No, not colon again.
The torso.
There we go, some ribs.
The torso is the part of the skeleton that protects the internal organs. In the back, the spinal column encases the all-important spinal cord while allowing humans to maintain an erect posture. The shoulder blades, scapulae, and clavicles provide an attachment point for the upper extremities. The ribs are important for protecting both the lungs and the heart. The pelvic bones serve to protect the organs of the lower abdomen and pelvis. They also provide an attachment point for the lower extremities.
Anything about the nose?
Welcome to the Body Adventure Inn.
There's so much. Why buy a book when you can buy a video game for $6?
Welcome to the Body Adventure.
Ah! Fuck. I was there, dude. I saw a nose. No, nose! Skull.
The skull. The skull consists of the cranium, which surrounds the delicate brain, and the facial bones. The cranium is formed by 8 bones: the frontal bone, 2 parietal bones, 2 temporal bones, the occipital bone in the back, the ethmoid bone behind the nose, and the sphenoid bone. The face consists of 14 bones, including the maxilla, upper jaw, and mandible, lower jaw. The bones of the skull are quite hard, and protection of the brain is undoubtedly their most important function. Interestingly, several of the bones are hollow, a feature which reduces their weight. Imagine how heavy your head might feel after a long day if these bones weren't hollow. These air-filled spaces are called the paranasal sinuses because they are located all around the nose. The membranes which line the sinuses sometimes become inflamed because of allergy or infection. This is a common condition referred to as sinusitis. All the skull bones, except the mandible, are held together by immovable joints called sutures. The mandible and the 2 temporal bones are held together by freely movable joints, which are named, not surprisingly, the temporomandibular joints, TMJ.
Yes.
The TMJs usually work well to permit all the complex motions required for chewing and talking. Some people, however, develop pain in their TMJs. This condition is called temporomandibular joint syndrome. TMJ syndrome is usually the result of spasm of the chewing muscles. Headaches, facial pain, and various popping noises are all common in patients with TMJ syndrome.
Okay,
Treatment is generally directed at reducing the muscle spasms and relieving the pain. Besides protecting the brain, the other major function of the skull is to house the special sense organs. The eyes, vision, ears, hearing, nose, smell, and tongue, taste, are all located in the skull. The sense of taste is accomplished by the approximately 10,000 taste buds. These are mostly located on the tongue, with a few located at the back of the throat. Surprisingly, there are only 4 different tastes that can be differentiated by the taste buds alone: bitter, salty, sour, and sweet. The taste buds for each of these 4 different tastes are grouped together on the tongue. Of note, the taste buds for sweet are all located at the very tip of the tongue. Our ability to distinguish a rich range of tastes is actually due to our sense of smell, which is much more developed than our sense of taste. The sense of smell is accomplished by special nerve endings that all sit in a small region in the roof of the nose. Our sense of smell is remarkably sensitive. As few as 4 individual molecules can produce a recognizable smell. The intestine.
The intestine.
No!
The
Not
lungs.
again! What the fuck? Jetpacks. Why are you breathing? This looks like a penis.
The lungs are a vital organ which enables the body to obtain oxygen from the air we breathe and to eliminate carbon dioxide. Breathing is accomplished with the chest wall muscles and the diaphragm muscle, which separates the chest cavity from the abdomen. When the chest cavity expands, the lungs expand with it, drawing air down into the lungs. When the chest cavity relaxes, the lungs shrink, and waste carbon dioxide is expelled. The lungs are not directly attached to the chest wall. Instead, they are encased in a double-layer membrane called the pleura. One of the pleural layers is firmly attached to the lungs, with the other one firmly attached to the chest wall. There's always a small amount of fluid between the 2 pleural layers, which allows them to freely slide over each other. The lungs are divided into distinct lobes, which are supplied by their own airways, bronchi, and their own arteries. On the right side, there are 3 main lobes called the upper, middle, and lower lobes. On the left, there are only 2 lobes called the upper and lower lobes. This anatomy is illustrated in the 3D model above. The fissures that separate the upper and lower lobes on both sides are called the major fissures. The right lung also has a minor fissure that separates the upper and middle lobes. Notice how the minor fissure is nearly horizontal, but the major fissures run at a steep angle. When a doctor listens to the breathing sounds on your back, he or she is listening to the lower lobes, even when the stethoscope is placed high up by the shoulder blades. One of the disorders sometimes seen in the emergency room is collapse of the lung. Surprisingly, the natural tendency of the lungs is to collapse into a small ball near the center of the chest.
What the fuck?
They are held in their normal expanded state only by the attraction between the 2 layers of the pleura. If you have ever tried to separate 2 sheets of wet glass, then you know how this works. Occasionally, air gets between the 2 pleural layers, causing them to separate, and the lung collapses. This is called a pneumothorax, meaning air in the thorax, chest cavity. The air can either come from the outside because of a penetrating wound, or from the inside because a part of the lung developed a hole in it. Another problem that is sometimes seen is excess water between the 2 pleural layers. This is called a pleural effusion, a condition commonly referred to as water on the lung. There are many causes for a pleural effusion, some benign and some quite bad. A pleural effusion is typically treated by sticking a needle or a tube into the chest and draining out the fluid.
Because he was talking about lungs, he had to breathe manually for that. A liver? Where's the pancreas? Where are you, little guy? There it is.
The pancreas.
The pancreas is an organ with 2 separate functions. First, the pancreas plays an important role in the digestion of food. The pancreas does this job by making digestive enzymes that are released into the pancreatic duct and then into the small intestine. The pancreatic duct usually joins the common bile duct just before it enters the duodenum at the ampulla of Vater. The second function of the pancreas is to make hormones that are released into the blood. The hormones released, insulin and glucagon, both play key roles in the regulation of blood sugar levels.
The gallbladder.
The fuck is that?
The gallbladder is a small sac which sits just beneath the liver. Its only role is to concentrate bile and then release it when food is passing through the small intestine. Bile is a sticky green fluid produced by the liver. Bile serves both as a fluid which helps the body to absorb fats and as a way to eliminate toxins. All the liver cells make bile at a constant rate. The bile is released into a network of bile ducts that all come together to form the common hepatic duct. The gallbladder is connected to the common hepatic duct by the cystic duct. Most of the time, bile flows up the cystic duct and into the gallbladder for storage. When food passes from the stomach into the duodenum, however, a hormone, cholecystokinin, is released, which signals the gallbladder
Take
to
a second
contract.
for that one.
The bile is squeezed back up through the cystic duct and down the common bile duct into the small intestine.
Liver.
The liver.
The toupee. Crazy how its shape is like that, huh? Wow.
The liver is the
Classic
largest
shape.
and one of the most vital organs. It consists of two main lobes, the right and the left, and a smaller third lobe called the caudate. The liver is one of two organs, along with the lungs, to receive a dual blood supply.
Damn, dual blood
It
supply?
receives most of its blood, 85%, via the portal vein, which drains nearly all the blood from the intestine. This ensures that all the absorbed food goes directly to the liver, where it can be packaged and stored for use when needed. The liver receives the other 15%
like a how
of
it's
its
made
blood
video.
from the hepatic arteries. This second blood supply is also important because the arterial blood is well oxygenated, unlike the venous blood arriving through the portal vein.
Any requests? The kidneys.
The kidneys.
The beans.
There are two kidneys, each about 6 inches in length. The main functions of the kidneys are to regulate the amount of water and salt within the body, to maintain the proper acid-base balance in the body, and to eliminate waste products from the blood. The kidneys are also responsible for making a few key hormones. One of these hormones, erythropoietin, is responsible for stimulating production of red blood cells, while
Who names
another,
this shit?
renin, plays an important role in regulating blood pressure.
The esophagus.
The stomach.
The stomach
No.
is the hollow
No, we didn't-
muscular organ where the
we didn't listen
process
to
of
that.
digesting swallowed food begins. Its walls are quite flexible, expanding to a volume of about 1.5 liters, 3 pints, after a meal. The stomach lining secretes
Enough
strong
for 3
acids
pints,
and
eh?
special enzymes that begin to break down the swallowed food. The muscular walls also churn the food, which helps to convert the food into a creamy paste.
Yeah.
Of note, the stomach wall also contains glands which secrete mucus. This mucus coats the inner lining of the stomach and prevents the stomach from digesting itself. Occasionally, the mucus barrier is disrupted for some reason, leading to the formation of an ulcer. Most ulcers will heal uneventfully with just antacids taken for therapy. Medications that reduce the output of stomach acid can also be used to help heal ulcers and prevent new ones from forming.
Imagine if your stomach just digested itself. Wouldn't that be fucked up? Damn. Talk about getting owned.
the pelvis.
The pelvis serves to support the upper body and to protect the lower abdominal and pelvic organs. It consists of the two large hip bones and the sacrum. The sacrum is the triangular bone that also forms the lower part of the spinal column. The hip bones are firmly joined to the sacrum in the back and joined to each other in the front. This structure creates a very strong and rigid ring of bone. Each hip bone is composed of 3 fused bones: the ilium, the ischium, and the pubis. The ilium is a large flat bone similar to the plates of the skull. The ischium is a round, curved bone which supports the weight of the body when sitting. The pubis is a smaller bone similar to the ischium. All 3 bones, ilium, ischium, and pubis, come together to form the hip socket, acetabulum. The pubic rami come together to join at the pubic symphysis. Symphysis is a word which simply means a joining of 2 structures. It can also have the more specific meaning of 2 bones that are joined by a fibrous joint. There are several notable differences between the male and female pelvis. In men, the pelvis is narrower and heavier. It is built to support a greater body weight. In women, the pelvis is broad and has a larger opening, built to allow childbirth. The pubic symphysis is also less rigid in women, allowing it to stretch and widen during childbirth. When examining the skeletons of human ancestors, anthropologists often use the pelvis to distinguish males and females.
Fucking large. Huge body. Huge body, huge pelvis. Anything about the tailbone?
Welcome to the Body Adventure Index.
Why do we have a tailbone? Tail. 6-week embryo. Sperm production. The penis?
Sperm production.
The male sex cells are called sperm. They each have a tiny head containing the genetic material and a long tail used to swim towards an egg cell. Sperm cells are quite small, measuring only 0.002 inches, 0.05 millimeters in length. Sperm are produced by the testes in a process referred to as spermatogenesis. This process begins in the seminiferous tubules and is completed in the epididymis. The original cells from which the sperm grow contain 46 chromosomes in humans. By a special division called meiosis, this number is cut in half so that the sperm cells contain only 23 chromosomes. These 23 chromosomes can then unite with an egg, also containing 23 chromosomes, to make a new individual.
Ready for legion grinding. 6.
Twins. 2 babies sometimes result from a single pregnancy, as shown in the illustration above. Twins can be either identical or fraternal. Identical twins develop from a single ovum which splits into 2 groups of cells soon after fertilization. Identical twins are also called monozygotic twins, meaning one zygote. Monozygotic twins always look remarkably similar because they are genetically identical. Fraternal twins develop from 2 separate ova, which are each fertilized before implanting in the uterus. Fraternal twins are also called dizygotic twins, meaning 2 zygotes. Dizygotic twins may or may not be of the same sex, since they are quite independent of one another. The frequency of twin births is about 1 in 90 pregnancies. Dizygotic twins are more likely to occur in women who have a family history of twins, and women who have had many babies before. In contrast, the development of monozygotic twins is random, and these factors do not play a role.
Interesting. Woman. Foot and ankle.
The foot and ankle.
Yes. This is what I think when I think of women.
The ankle is a hinge joint connecting the bones of the lower leg tibia and fibula, and the uppermost bone of the foot, talus. The ankle is held together by several strong ligaments which provide stability and prevent excessive movement. The ankle only allows simple upward and downward motions of the foot. Other foot movements require motion of the joints within the foot itself. Because the ankle is subject to great stress, sprains of the ankle ligaments are very common. Each foot has 26 separate bones. The two largest foot bones are the calcaneus,
when the ankle's ever
heel
okay,
bone,
huh? Always
and the
fucked
talus.
up.
Long tendons attach many of the bones of the foot to strong muscles located in the lower leg. There are a number of disorders that are frequently seen in the foot. These include corns, bunions, and gout. Corns are small areas of thickened skin, usually caused by tight-fitting shoes. A bunion is a firm, fluid-filled lesion that forms over the base of the big toe. Like corns, bunions are usually the result of wearing tight, pointed shoes. Bunions sometimes require surgical removal and reconstruction of the great toe to prevent them from recurring. Gout is a form of arthritis that commonly affects the joint of the great toe. Gout results from the formation of uric acid crystals within a joint. These crystals cause significant inflammation and pain in the affected joint. A person suffering from an attack of gout in the great toe is generally unable to even stand on the foot. Unlike corns and bunions, which are more common in women, gout is 10 times more common in men.
Gout! Men. Blood bank.
Migraine headache.
Of the many ailments of the brain, the most common is headache. Interestingly, the brain itself contains no sensory fibers, and it cannot actually cause pain. Instead, headache pain comes from the meninges which cover the brain and the scalp with its muscles and blood vessels. Headaches are usually a response to external stimuli. Only rarely are they indicative of a serious underlying disorder. The most severe headache type is migraine. Migraine headaches are usually accompanied by nausea, vomiting, and disturbances of vision. The disturbances of vision precede the pain and are called an aura. Other neurologic symptoms such as weakness can also occur. Patients experiencing a migraine headache usually choose to lie very still in a dark room while waiting for the pain to subside. Migraine headaches are relatively common, affecting 3 times as many women as men. Migraine sufferers typically report a definite pattern to their headaches, and they can report what stimuli bring them on. Most migraine sufferers experience their first attack before the age of 20. There is no single cause of migraines, but the tendency to get migraines does tend to run in families. A new medication, sumatriptan, shows promise for the relief and prevention of migraine attacks for many patients.
Wonder where they are now. This sumatriptan. Weak brain. Not enough grinding in Maple Story. The more you grind, the more resistant you are to a migraine.
Welcome to the Body Adventure Index.
Orgasm. Is it anywhere? Organ? Holy shit. Organelles? On the tip of a pin, what the fuck?
On the tip of a pin, bacteria are remarkably small. The photograph above demonstrates their size relative to the tip of a pin. The immune system is usually adequate to allow recovery from exposure to bacterial illness. The advent of antibiotics, however, has revolutionized the treatment of serious bacterial illness that has not been controlled by the immune system. These medications work either by killing bacteria directly, or else by stopping their growth in order that the immune system can more effectively eliminate them. Unfortunately, bacteria frequently develop resistance to the antibiotics which once killed them. In effect, a war has begun between the scientists that keep developing new antibiotics and the bacteria which seem to develop resistance to those antibiotics at an ever-increasing rate. The most simple explanation for emerging resistance is selection pressure. If only one in a large number of bacteria is resistant to a drug, then all the other organisms will be killed and the resistant cell will multiply to replace the dead bacteria. This process occurs because bacterial reproduction is so rapid, occurring about once every 20 minutes. After 6 hours, a single bacterium can regenerate a population of 1 million. This is a strong argument against the indiscriminate use of antibiotics, which only leads to more and more resistant strains.
Ah! Did this game tell you about how if your immune system could recognize your eyeballs, it'd kill them? No.
Welcome to the Body Adventure Index.
I wish I could, like, type it, not click it. How am I gonna find the immune system? Like, in the immune system? Maybe. Immunization. And antibodies.
Antibodies.
This picture shows several Y-shaped antibody molecules within a blood vessel. Antibodies are made by the immune system to react with specific foreign invaders. Bacteria, viruses, and other microorganisms are all common pathogens that will usually elicit an antibody response. Once made, antibodies stay in the circulation for many years, in some cases, even a whole lifetime. If an individual is re-exposed to a pathogen for which they have previously made antibodies, they will be able to eliminate the pathogen before it causes any problems.
The spine. The eye.
Whoa! Looks like a balding person.
The eye is a complex organ that provides the sense of sight. The eyeball has a tough outer coat called the sclera, which forms the white part of the eye. The circular, most forward part of the eye is called the cornea. The cornea is transparent. Behind the cornea is a fluid-filled space called the aqueous humor, watery fluid. Moving further back, there is the colored part of the eye called the iris, with a black hole in its center called the pupil. The iris changes the size of the pupil in response to changes in brightness. Directly behind the iris is the lens. The lens changes shape to help focus the light rays entering the eye. But surprisingly, most of the focusing of light rays is done by the cornea. The main body of the eye behind the lens is filled with a clear gel called the vitreous humor. At the very back of the eye is the retina. The light rays fall on the retina, which converts those light rays into signals that are processed by the brain, allowing us to see. The eyeball itself is moved by 6 delicate muscles called the ocular muscles. 4 of these muscles are shown in the 3D model above.
Yeah, crazy how evolution figured this shit out. Yes, I'll make an eyeball.
Pupil. The retina. The retina is the light-sensitive surface at the back of the eye. The photograph above shows a picture of the retina as taken with an instrument called an ophthalmoscope. The retina contains a vast number of specialized nerve cells called rods and cones that convert light rays into nerve signals. The cones provide color vision and are most concentrated at the fovea. The fovea can be seen in the photo above as the region on the left side without any blood vessels crossing it. Because of their dense concentration, the cones in the fovea provide the finest resolution vision. The rods are much more sensitive to light than the cones, but they only provide black and white vision. Next time it is dark out, notice that you only see in black and white. All of the rods and cones connect with nerves, whose signals exit from the eye via the optic nerve. The optic nerve, along with the retinal artery, pierces the eye at the optic disc. The optic disc is visible in the picture above on the right side. There are no rods or cones in the optic disc, which creates a small blind spot on the retina. It is possible to demonstrate this blind spot, but people are not normally aware of it.
Huh? Okay.
The larynx.
The larynx is the organ commonly referred to as the voice box. The 3D model above shows two of the major components of the larynx, the cricoid cartilage and the arytenoid cartilages. Each of the two vocal cords is tightly stretched between one of the arytenoid cartilages and the cricoid cartilage. Together, the vocal cords form a V structure which vibrates when air is passed over it. Speech is accomplished by moving the vocal cords while they vibrate in order to modulate the sounds that are made. The other major function of the larynx is to prevent choking. Whenever a person eats or drinks, a structure called the epiglottis covers over the entrance to the larynx to prevent swallowed food from entering the lungs. Another important structure in the neck is the thyroid gland, which lies just in front of the larynx. The thyroid gland uses iodine to make thyroid hormone. This hormone is released into the bloodstream, where it plays a very important role in regulating overall body metabolism. People with underactive thyroid glands feel quite tired and sluggish. In contrast, people with overactive thyroid glands experience rapid heart rate, sweating, anxiety, weight loss, and heat intolerance.
Also me.
The most common cause for an overactive thyroid gland is Graves' disease. Graves' disease is an example of an autoimmune disease in which inappropriate antibodies are made which bind to the thyroid gland and stimulate it to produce too much thyroid hormone. This problem is usually treated by administering radioactive iodine, which kills off the excess thyroid activity when it is taken up by the thyroid. Studies have shown that this treatment is not only effective but entirely safe, with no increased incidence of cancer. Another cause of excess thyroid activity is Plummer's disease, a disease in which one or a few specific thyroid nodules overproduce thyroid hormone. This can also be treated with radioactive iodine, but it is usually more effective to remove the overfunctioning nodules surgically. When doing thyroid surgery, it is very important not to damage the 4 tiny parathyroid glands which lie above and below the thyroid on both sides.
I'll remember.
These glands play a major role in the regulation of body calcium. This is an important job because nerve and muscle cells only function correctly when the blood calcium level lies within a very narrow range.
Make sure not damage those. Is there, plumber? Alveoli. Jonas Salk.
Jonas Salk. In the mid-20th century, polio raged as a major health problem. Polio is caused by an infectious virus that brings on paralysis and disability by damaging nerve cells. In 1954, Jonas Salk and his colleagues were able to build on the work of Edward Jenner by demonstrating that people who were exposed to a killed polio virus preparation would develop lasting immunity to the disease. The picture above shows Dr. Salk administering this vaccine to a child. The Salk polio vaccine was widely used between 1956 and 1960 in the United States, with dramatic results. In the early 1960s, a second polio virus vaccine was developed by Dr. Sabin. It consists of live but severely weakened polio viruses that can induce immunity but cannot cause disease. The chief advantage of this vaccine is that it can be administered orally rather than requiring injection.
Yummy polio, yum yum. Yum yum, nice tasty snack.
blood.
The kidneys receive their blood supply directly from the aorta through the renal arteries. These
Cleansing
arteries
the
branch
weak.
again and again within the kidneys to form small capillary tufts called glomeruli. Each kidney contains about 1 million glomeruli, which together serve as the filter for cleaning the blood. Blood cells and big molecules are kept within the glomeruli, but water and small molecules all pass through their walls. In fact, about 140 liters of fluid pass out of the glomeruli each day.
What?
All this fluid passes into the renal tubules, where 99% of it is reabsorbed back into the blood. At the end of the tubules, however, the waste products, excess salt, and some of the water remain unabsorbed. These things form the urine, which drains down the ureters and into the bladder.
Urine. Shock waves.
Shock waves.
Sometimes
The blasting
kidney
is
stones
big.
form which are simply too large to pass.
Oh, fuck.
In the past, doctors used to perform surgery to remove the stones. In recent years,
just
however,
blasting the
doctors
rocks
have
away.
begun using a machine called a lithotripter to treat large kidney stones. This treatment is non-invasive and relatively simple. As shown in the picture above, the patient sits in a bath of warm water during the procedure. The lithotripter then emits high-energy sound waves which are focused on the kidney stones. The sound waves pulverize the stones into small fragments that can then be passed through the urine.
Wow. It's kind of epic.
Diabetes.
Diabetes mellitus is a common disorder caused by insufficient insulin production. Without adequate insulin, the body fails to use glucose, sugar, properly. The blood sugar level rises in the blood, and the extra blood sugar is eventually spilled into the urine. This leads to the classic symptoms of increased urination and excessive thirst. There are two main types of diabetes: insulin-dependent diabetes type 1 and non-insulin-dependent diabetes type 2. Type 1 diabetics are usually diagnosed between the ages of 10 and 16. In these people, the pancreatic cells that normally make insulin are completely destroyed.
Oh, shit.
As the name implies, these people must receive replacement insulin in order to avoid severe symptoms. Even with regular insulin replacement and tight control of their blood
Yeah, I'm
sugar
past the
level,
age. Whew.
most type 1 diabetics develop complications over the years. The most common problems include retinal damage, kidney damage, general nerve damage, and higher than normal rates of atherosclerosis. The illustration above shows an eye that has sustained some damage to the retina because of diabetes. The reason for all these long-term problems is not completely understood.
Wonder if it is now.
Type 2 diabetics are quite different. They develop their disease gradually, and they can usually be treated with diet modification. Medications are also available if necessary. These people tend to be obese, and they are much older than type 1 diabetics.
Heart attack.
Ah!
People with coronary artery disease are at high risk for having a heart attack. A heart attack occurs when the blood supply to a part of the heart is suddenly cut off and the affected heart muscle dies. The usual cause of a heart attack is the formation of a blood clot at the site of an atherosclerotic plaque. The clot completely blocks the artery, cutting off blood flow beyond it. The medical term for a heart attack is myocardial infarction. Heart attacks are the #1 cause of death in Western societies. The risk factors for having a
Wonder
heart
why.
attack are well known. These factors include a diet high in fat and cholesterol, smoking, obesity, physical inactivity, high blood pressure, diabetes, and a family history of heart attacks.
True.
Fortunately, most of these risk factors are related to lifestyle. It is thus possible for a person to lower their risk of a heart attack if they choose to. Of note, the incidence of heart attacks is 4
Simply choose
times
to not
lower in
have them.
Japan than it is in the United States. This is because the major risk factors are much less common in that country. The diagnosis of a heart attack is based mostly on the patient's symptoms. Typically, a patient having a heart attack experiences severe chest pain, sweating, nausea, and anxiety. The diagnosis is confirmed by an EKG along with blood tests. If a patient arrives at the hospital soon after their symptoms began, they will generally be treated with a medicine, thrombolytic, that works by dissolving blood clots. This treatment is often successful at reopening blocked arteries and limiting the damage done to the heart. The severity of a heart attack is determined by how much of the heart dies. If too large a part of the heart is affected, the remaining heart muscle is unable to continue pumping the blood. Approximately 1/3 of heart attacks are fatal. Advances in medical care over the past 30 years have greatly improved the outlook for patients that survive a heart attack.
Now imagine today. Another 30 years difference. Yo, calm down. Oops. Ten-week fetus.
10-week fetus.
Yo, what the
The
hell?
developing child is referred to as a fetus rather than an embryo after the 8th week. The photograph above shows a fetus at approximately the 10th week of development. At this point, the fetus is about 2 inches, 5 centimeters in length.
Yeah, the OST kind of
Blood
pops.
cells are being produced by the liver and spleen, and the now completed fetal heart is already pumping these red blood cells around the body. At this point, all the organs have formed. Further development mostly involves maturation of these rudimentary organs.
Fucking goblin.
Eight-month fetus. By 8 months after conception, fetal development is nearly complete. The baby can be expected to do satisfactorily if it is born at this stage, though there could be minor complications. Among the last things to develop to full maturity are the lungs. The illustration above shows the fetus with its head down, firmly seated
You
against
guys
the
clipping
cervix.
out, man.
This is the
Get him
optimal
back in
position
there.
for the fetus to be
He's not
in
done
for
yet.
vaginal delivery. Also evident in the illustration is the placenta, which serves as the connection between the fetus and the mother.
And a tasty snack in some cultures. Mother! Breech babies.
Breech babies. By the 8th month of pregnancy, most babies have assumed a head-down position. If the baby is not head down, then it is said to be in a breech position. It is sometimes possible to move a baby into the head-down position by pushing from the outside. If this is not successful, then the baby will often remain in the breech position throughout the remainder of the pregnancy and delivery. Breech deliveries are more difficult for both the baby and the mother because the baby's body does not mold a path through the pelvis as well as the head normally does. Some doctors will try to deliver a breech baby vaginally, while others prefer to perform a cesarean section for breech babies because it poses less risk to the mother and to the baby.
So are these both examples of breech babies? Because they're not head down. Could have given a good example.
Ball and cage valve. The second most common major heart operation in the Western world is valve replacement. Any one of the 4 heart valves may become either so tight or so leaky that it needs to be replaced in order to restore normal heart function. As a rule, valve replacement surgery has a very high success rate. Long-term complications from rheumatic fever are still the most frequent cause of severe valve malfunction. Many different types of artificial heart valves have been devised over the years. The picture above shows a mechanical ball and cage valve, which has been widely used. Another popular mechanical valve uses either 1 or 2 tilting discs. It is also common to use tissue valves taken from pigs, porcine valves. Least commonly, valves can be taken from human organ donors. Mechanical valves last longer than porcine or human tissue valves, making them more suitable for younger patients. On the other hand, mechanical valves damage red blood cells more than tissue valves do, and they tend to cause the formation of blood clots. Because of this, all people with mechanical valves need to take anticoagulant medication, blood thinners, to prevent blood clots from forming. The choice of what type of artificial valve to use is thus a difficult question that must be decided for each individual requiring a valve replacement operation.
Such an interesting picture. Is this what they shove in you? I don't get it. Like a needle there, so I'm guessing it's kind of small. What the fuck? Chemical factor. So there's like
Welcome to the Body Adventure Index.
there's like the vagina, but there's no penis. What's up with that? Can they not say penis? Where is the penis? Yeah, but they never say the word. They'll say vagina. No problem. They'll say it like 6 times in the one sentence. But never penis.
Male reproductive system.
The illustration above shows
I know. No way, no how they're gonna say penis in here. The urethra. Closer. No way, no how.
Female
Then here they just say the
system.
vagina
The
open.
female reproductive system consists of the ovaries, the fallopian tubes,
Hell, they'll
the
talk
uterus,
about every
and the vagina.
goddamn part.
These structures are all shown in
The
the illustration
vulva.
above, with the ovaries and uterus.
I guess the correct term here would be the vulva. The stuff that's outside, you know? Vagina is just...
Uterus. Uterus and ovary. The uterus.
Mamma mia. Look at those hips. Let's see a swimming sperm.
Swimming sperm.
The photograph above shows a single sperm cell close up against the wall of the uterus. The sperm cell at this point has already survived a major part of the long journey toward the ovum. Of the 300 million sperm that begin the quest, most succumb to the inhospitable environment within the vagina.
Dangerous
Many
place, the
more sperm
vagina.
are lost while trying to navigate through the mucus which blocks the passage through the cervix into the uterus. Those sperm that make it this far continue to swim upwards toward the fallopian tubes and the waiting ovum. Half of the sperm will inevitably enter the wrong fallopian tube, but of course, half of them will stay on track.
Damn. It's crazy, dude. None shall survive. Not only do you have to survive, but you have to fucking figure out a 50-50. Crazy. Let's see how cool an embryo looks like.
7-day
What the
embryo.
fuck?
On about the 6th day past fertilization, the sphere of cells implants into the uterine lining. At this point, the developing embryo begins to obtain its nourishment from the mother. The outer layer of cells go on to form the placenta at the point of attachment to the uterus. The embryonic cells, all initially in a ball, next begin to separate to form a flat disc with a fluid cavity on either side. The embryo at this stage is called a blastula. The flat disc contains the cells that will ultimately
Play
go on
blaster.
to form all the baby's tissues. The amniotic sac develops around the embryo as it grows.
What about gross? Malaria.
Malaria.
Scary music.
Malaria is a parasitic disease spread by the bites of Anopheles mosquitoes like the one shown in the illustration above. The parasites responsible for malaria are single-celled organisms called plasmodia. The plasmodia spend part of their life cycle in humans and the remaining part in the Anopheles mosquitoes. The plasmodia reproduce in human red blood cells. When the plasmodia are mature, the red blood cells burst and release more plasmodia, which then go on to infect even more red blood cells. The bursting of the red blood cells tends to occur in cyclic fashion, every 2 or 3 days depending on the type of malarial parasite. There are 4 different types. When the red blood cells burst, it produces severe chills, rigors, followed by a very high fever. These are the characteristic symptoms of malaria. Malaria is a serious illness that is oftentimes fatal because of all the burst red blood cells, which can cause failure of the kidneys and liver. The broken red blood cells can even block blood vessels to vital organs such as the brain, leading to convulsions and coma. Malaria is present in much of the tropics throughout the world. In Africa alone, malaria kills more than 1 million infants and children every year.
God damn.
Those that survive develop some measure of immunity. The World Health Organization has embarked on a massive effort to control malaria with only limited success. The mosquitoes have developed resistance to the insecticides, and the plasmodia that cause malaria are developing resistance to the drugs normally used to treat the disease. It is very unlikely that anyone would contract malaria in the United States, but about 1,000 U.S. citizens contract malaria each year as a result of travel abroad. It is absolutely necessary for people traveling to endemic malaria regions to take medications that inhibit the malaria parasites from growing and to take precautions to avoid being bitten by mosquitoes.
Impossible.
Of note, sickle cell disease has an important relationship to malaria that is easily explained. Normal people have 2 copies of the gene, DNA segment, that specifies how to make a beta hemoglobin chain. Sickle cell disease occurs when both of these copies are replaced with abnormal sickle cell versions. Recall that red blood cells are entirely filled with hemoglobin molecules. People with 2 normal beta hemoglobin genes make normal hemoglobin and are very susceptible to contracting malaria. People with 1 normal gene and 1 of the sickle cell genes make a hybrid form of hemoglobin that renders the red blood cells more resistant to malaria. People with 2 copies of the sickle cell gene produce sickle cell hemoglobin, which causes sickle cell disease. Over the thousands of years that people have been exposed to malaria, there has been strong selective pressure to keep the sickle cell gene around, despite the fact that it causes a serious disease when someone winds up with 2 copies of it.
Kill. Lung cancer.
Welcome to the Body Adventure in...
A secret button here? Quest. Swimming sperm. Conception.
Conception. The photograph above shows a portion of an ovum with many sperm all trying to fertilize it. This is the last step in the quest to reach the ovum. Only one of the sperm cells will successfully enter the ovum. The outer coating of the ovum is tough.
However, the heads of the sperm cells contain a digestive enzyme which breaks down this coating to allow penetration. At the instant that one of the sperm cells breaks through, a reaction takes place which changes the outer coating of the ovum and prevents any more sperm from entering.
Total shutdown.
Welcome to the Body Adventure Index. Just
I found my
I
toes.
found my toes. Children.
Oh, it's these stupid babies. Fuck off. Stupid dumbass babies.
health and diet.
More and more, people are recognizing the important relationship between health and diet. Many of the most common health problems in Western society have been proven to be diet-related. Most notable is atherosclerosis, which leads to both heart attacks and strokes. Many forms of cancer appear to be linked to diet as well. Although opinions change as to what the optimal diet should be, it is clear that a low-fat diet reduces the incidence of atherosclerosis and may reduce the incidence of some cancers. Most people agree that a diet high in complex carbohydrates, including fruits, vegetables, and grains, is best. Meat and dairy products are fine, but needn't be the main part of one's diet.
What?
Total fat intake should be kept to only 15% of total calories if possible.
Wow. Meat. The thrombus.
A platelet plug is merely the first step in the process of stopping blood loss when a blood vessel is damaged. The activated platelets and damaged vessel
that's what I
walls
think about
also secrete
every one of
chemicals
these
which
entries.
begin the blood coagulation process. This process is a complex cascade that results in the formation of fibrin strands. The picture above shows
Like,
a
are
number of
sperm
red
even
cells
real? Who
trapped
even
within a
knows
mesh
anymore?
of fibrin strands. This mesh is referred to as a thrombus. The coagulation cascade is designed to permit significant amplification of the signal to clot. Activation of just one molecule of the first factor in the cascade can result in the formation of 30,000 fibrin molecules at the site of the injury. At the same time, it is important that blood clots do not form when they are not needed. There are also anticoagulation, thrombolytic factors in the blood that rapidly dissolve inappropriate clots. A delicate balance between the pro-clotting and anti-clotting mechanisms is always maintained. There are a large number of clinical disorders affecting the coagulation mechanism. The most well-known is hemophilia, a disease that is present in about 1 in every 10,000 males born. It is caused by a lack of factor VIII, one of the chemicals in the coagulation cascade. Without this factor, the cascade fails and fibrin strands are not formed. Hemophiliacs thus suffer from frequent and severe bleeds. Treatment involves the administration of the missing coagulation factor VIII.
Holy shit. So much about fat.
Stroke.
Stroke occurs when the blood supply to part of the brain is cut off for long enough to cause the death of that part of the brain. This does not take very long. Neurons in the brain can only live for about 4 minutes without oxygen. Another condition closely related to stroke is transient ischemia attack, TIA. A TIA initially seems like a stroke, but the symptoms quickly disappear. TIAs occur when the blood supply to a part of the brain is interrupted for long enough to stun the affected cells, but then restored before cell death occurs. Strokes are fatal in about 1/3 of all cases, a percentage similar to that observed with heart attacks. For the survivors, a stroke can be quite devastating due to the loss of important brain functions.
Sometimes, however, another part of the brain is able to take over the functions of the lost part of the brain. The risk factors for having a stroke are generally the same as those for having a heart attack. The most notable are high blood pressure and atherosclerosis. A recent heart attack is itself a risk factor for stroke because of the tendency for blood clots to form in the heart and then travel upwards to the brain. Several studies have shown that aspirin taken every day can decrease the chances of having a stroke in patients who have previously suffered from a stroke or a TIA. Aspirin works in this way by preventing blood clots from forming. It has also been shown that a small dose of aspirin every day can decrease the rate of heart attacks, even in patients who have not previously had any symptoms. Many doctors thus recommend that their patients take a single baby aspirin every day.
Take the aspirin's newborn. Oh. I should have given him an aspirin. Pure pain. Breast.
The primary
That's a big breast. Damn. Mammography. Breastfeeding.
Newly born. Breastfeeding is the natural method of feeding infants. It was, of course, perfected long before people ever came up with the idea of baby formula. Today, most doctors agree that breast milk provides the newborn infant with the ideal balance of nutrients. It also provides the baby with antibodies from the mother which help to prevent infections until the baby's immune system becomes stronger after a few months. There can be problems with breastfeeding, including sore or cracked nipples, but these problems can usually be resolved without stopping breastfeeding. However, there are a number of legitimate reasons to choose bottle feeding rather than breastfeeding. The choice not to breastfeed is one that a woman should make after consultation with someone knowledgeable about the subject.
Knowledgeable. What? Someone. What? With what? Consultation. What? Subject. What? Months. The elbow. Yo, you're creaking.
The elbow is the hinge joint which connects the lower end of the humerus with the upper ends of the radius and ulna. The elbow permits the arm to be bent by the powerful biceps muscle and then straightened by the triceps muscle. The biceps and triceps thus form a pair of muscles which have opposite actions. It is a general rule that the muscles of the body are organized into pairs or groups which have opposite actions. The elbow also allows the forearm to be rotated without moving the upper arm. This is very important for some actions, such as turning a doorknob. This rotation motion is called either supination or pronation. Supination is the action of turning the palm face up when the arm is held straight out, away from the body. Pronation is the action of turning the palm face down when the arm is held straight out. Following the general rule, these important movements are accomplished by a pair of muscles with opposite actions. The words supination and pronation are related to the words supine, which means to lie face up, and prone, which means to lie face down. Repetitive motions can strain the tendons of the elbow and cause pain. Tennis elbow and golfer's elbow are common conditions resulting from overuse and strain of the elbow tendons. Most everyone has felt the pins and needles sensation caused by hitting the tip of their elbow. This is often referred to as hitting the funny bone.
It's the best
The
dude
temporary
ever.
pain is caused by impingement of the ulnar nerve, which travels through a narrow groove close to the surface of the skin as it passes over the elbow.
Honestly, this game is badass, man. Even though it's too much for my brain to process, like, damn. So much information.
The digital hand.
What? Scary. He's gonna grab you. Where's that symbol? The symbol appears.
The hand is the most versatile part of the skeleton. It enables people to grasp and
True.
manipulate objects. The hand is comprised of the wrist, carpals, palm, metacarpals, and fingers, phalanges.
The
There
people's
are three
elbow.
main nerves which travel to the hand: the median nerve, the ulnar nerve, and the radial nerve. Each of these three nerves connects with a specific part of the hand to permit movement and sensation. Intricate hand movements are achieved by using the small muscles that are contained entirely within the hand, the intrinsic muscles, and the much larger forearm muscles. The forearm muscles are connected to the bones of the hand by long tendons. Tendons and ligaments are often confused with one another. A tendon is the fibrous attachment of a muscle to a bone. A ligament is a fibrous attachment between bones.
But that helps.
The digital hand.
Alright. Well, I'm sure there's like another 80 things I can click, but I think we've got. But I think we had enough, you know? It's a cool game, though. If you can call it a game. Bye-bye! Like,
The hand is the most versatile.
a lot of care and passion went to this. Brain melt is actually a true.
Welcome to the Body Adventure in.
Where is it? Brain melt. Boom! Is this the brain? No, dude.
I love you.
Day embryo and 28-day embryo. Human brain. Anyways.
The carpal tunnel.
A good way to end it. Cool. Shut up, bitch. Okay. Oi. Suffering from brain expansion right now. Yeah. Tonight, I'm probably not gonna go to the thing I have, so there'll probably be normal times. But Strong Bad's Dangerous, the room triangulate, is rather short, so we'll see if we do something else afterwards as well. We'll see. Hour later, exactly. But yeah, I don't know. Don't really feel like I have a hard time waking up at 6 p.m. How am I gonna wake up at 12 p.m.? You know? I'm just gonna feel like shit the whole week. Just to basically be there. Like, hello, I am here. Come on. It's whatever. Meow. Like, we're not even gonna play 3D Body Adventure. Like, who gives a shit? Ride a huge wave. Yeah, and I have to grind in MapleStory, so. Anyways, see you guys tonight. Thanks for watching. Cool games. Interesting. We've learned a lot. Oh! I'll let you guys be. Thank you. Bye. See you next time. Bye bye. Beep. You got anything to say, Lily? No? Okay. Jeez, okay. Huh?